we welcome you to the weekly briefing on the work of the Gauteng Provincial Command Center. Which houses the Gauteng Provincial Command Council. So we welcome you to our command center. Today we will definitely take you through the progress that we have been making in implementing our response plan, the Provincial COVID-19 Response Plan. Although COVID-19 is essentially a health pandemic, it has significant social and economic impact that go far beyond the public health system. And for that reason, we approach our work as the Gauteng Provincial Command Council based on the following 5 pillars of our response plan. The first pillar is about putting forward a comprehensive health response. The second pillar is about the food security response. The third pillar is about law enforcement and compliance with the regulations. The fourth pillar is about an economic response, even as early as the stage to look at what mitigation measures we're putting in place to ensure that as we are dealing with COVID-19, those who are negatively impacted or sectors that are negatively impacted in the economy are supported. And the fifth pillar is about social mobilization and social solidarity. You're going to hear this a lot because most of the time we've been talking just about the health response. Yes, it's because this is a health pandemic that has created a health emergency in the world. But today we are taking you through all the 5 pillars, the work that we are going to be doing in all the 5 pillars, so that you can understand the comprehensive nature of our strategy. So in each of these pillars that I have explained, there are detailed plans that are being implemented by the teams that are operating under the Provincial Command Council. So let me first take you through some briefing on the health response. So our comprehensive health response would include giving you, as we always do, an update. Last night, Dr. Mkhize, the Minister of Health, reported that South Africa has 2,506 confirmed cases nationally. In that number, Gauteng has 930, and that constitutes 37% of the recorded and confirmed cases. You may recall, ladies and gentlemen, that before the lockdown, Gauteng constituted 52% of all confirmed cases. In other words, all confirmed cases in South Africa before the lockdown, 52% of all those cases were in Gauteng province. And I've just reported to you that as of yesterday, the number of cases that our province is reporting constitute 37%. We want to say that it is something we are watching every day. And in our view, the lockdown has assisted a great deal, particularly as it pertains to the ports of entry, and I'll come back to this point later. But the decisive one was the closure of OR Tambo Airport. Every week when we give you the updates, we also give you the breakdown of numbers. The MEC for Health now releases on a day-to-day basis the regional breakdown As of yesterday, the latest figures, out of the 930 confirmed cases, Johannesburg has 558. And Johannesburg is the epicenter of COVID-19 in Gauteng. And Gauteng remains the epicenter of COVID-19 in South Africa. Although I've indicated to you that the lockdown has assisted in reducing how many cases we are getting every day and in reducing the total number of cases from 52% to 37% of the national confirmed cases. Sadly, we have lost 5 of our fellow Gauteng residents to this battle against COVID-19, as of the report given by the Minister of Health last night. And I want to take this opportunity on behalf of the provincial government and the people of Gauteng to convey our heartfelt condolences to the bereaved families. And we also say, may the souls of the departed rest in peace. It is not easy to lose your loved ones. It doesn't matter how old they are. Even if they are senior citizens, they were still very dear to their families, and they were very dear residents of our province. We are, however, comforted and encouraged by the fact that 479 patients have recovered from COVID-19 in Gauteng province. And just to give you an interpretation of that, this means that 51.5% of those who were infected since the first infection was recorded in Gauteng province, 51.5% of those who were infected have recovered. However, we are not complacent because the journey to the peak remains very, very long. Some additional statistic is that we have 101 patients who are hospitalized. And this is as of yesterday, and 15 of these are in ICU. If you look at that data, it means that 1.6% of all those infected have required intensive care. So the 15 out of 930 are those who are currently under intensive care, who are receiving that level of treatment. We have also significantly improved contact tracing. We have also scaled up capacity for screening, and we have increased the number of those who have been tested. We identified 6,431 contacts. In other words, these are people who came into contact with someone who was positive. We identified through our contact tracing mechanisms, which we have improved intensively. We identified this 6,431 as people who need medical, our contact tracing teams to ensure that there's surveillance on them. So out of that number, out of 6,431 of people, we said, these are contacts. And you know, to combat the spread of COVID-19, identifying contacts is very, very important. Not just identifying them, but doing something about those contacts so that those contacts themselves are monitored so that they don't infect other people in order to spread COVID-19. So far, 2,394 of these 6,431 contacts have now been cleared of COVID-19. The remainder, which is 4,037, remain under medical surveillance by our health professionals and contact tracing teams. And Dr. Masuku will explain what extensive work is done. Once we have identified people as contacts, some of whom may be in self-isolation, others may be put in our quarantine facilities, which we have across the province. Until they are cleared, we make sure that our health professionals watch over them, and they undergo tests as well to ensure that they can only be released when they are cleared. So contact tracing is a very important weapon in the struggle against COVID-19, so that there are fewer and fewer people who have been identified as contacts who are cleared, and work is done to ensure that they don't interact with other people in order to infect them. Since the 31st of March, that is 2 weeks ago, our community health care workers and our health professionals have screened 196,421 people. 196,421, close to 200,000. They will surpass 200,000 by the end of the day today. And out of that, 2,591 were referred for testing, screening, and the sequence is always very important. We are at the stage as a country where it starts with screening, and then people are then referred for testing out of screening, and then tests are conducted. So we have tested 2,591 people, but has screened close to 200,000. As I said, by the end of the day today, we would have reached that 200,000 people who are screened. The screening and testing, again, is targeted. We want to continue to explain this. I get lots of phone calls from people who say, when are they coming to my area to test us? At this stage, and this has been explained by our team of scientists, what the real challenge is. At this stage, we are not testing everybody. We want to screen more people. We want to test more people, but it would still be, especially testing, it's still not testing everybody. And Dr. Masuku will explain with regard to the trajectory of this pandemic, how are we planning to step up the numbers of those that will be tested. But this is the work guided by the National Command Center, including the rapid test kits that will be soon available. So if we are not screening everybody, if we are not testing everybody, but we're screening more people, we're also targeting areas. Again, areas that are high density, places where our contacts are. So I've spoken to you about the 6,431 contacts, where they are concentrated, in those areas where they are concentrated. Even though those contacts are kept under medical surveillance and they must adhere to all regulations, those, particularly those who are in self-isolation, even though that is the case, we make sure that our screening and testing is targeted to those areas where we have the larger number of contacts, those communities. In addition, we also direct this effort around screening to communities where there's high level of vulnerability. That would be high density townships, as well as informal settlements. Again, there I get lots of phone calls from people, but when are they coming to my area? When are they coming to test us? I get messages. Again, the process is conducted in line with the stage at which we are as a country, which has been explained, that it's not going door to door to test everybody, but we will increase screening. Dr. Masuku will explain what our target is. We will increase screening exponentially, whilst testing will continue to be directed to either those who have some symptoms or those who have actually come into contacts with people who have tested, who are COVID positive. In addition to this work on screening, testing, and tracing contacts, we have been doing significant work in preparing more beds for COVID. And in this province, we have cleared some of the existing hospitals to declare either the whole hospital or part of the hospital a COVID-19 facility. So in this first exercise regarding existing facilities, how many beds have we been able to clear and ready them for COVID patients? So 555 standard beds and 308 ICU beds have been cleared and have been made ready for COVID-19 in our existing facilities. So that's the first intervention on preparation of our facilities, our health facilities for COVID. The second intervention, so in addition to this 555 standard beds and 308 ICU beds, we are putting up new wards in some of our hospitals, and I want to list those hospitals: Kopanong Hospital in the Vaal, Jubilee Hospital in Tshwane, Chris Hani Baragwanath in Johannesburg, and George Mukari in Tshwane as well, in Tshwane North, the northwest of Tshwane. So these additional wards we are putting are permanent wards. These are permanent structures that we will use even beyond COVID-19. And this intervention of putting in new permanent wards will create 800 new beds in our existing hospital. You remember earlier on I spoke about 555 standard beds and 308 ICU beds. That's one category. The 800 beds that will be created by us putting up new structures using alternative building technologies, and these are not shacks. These are structures that are solid, that is to help us expand the capacity of the current facilities which I have listed. So out of that, we will have an additional 800 new beds. So that's the second category of additional beds. The third category of beds relates to a facility we are putting up in Nasrec, not far from where we are. 2 days ago, the MEC for Health, Dr. Bandile Masuku, visited the Nasrec area, and in this facility we will have 500 new beds. So if you add the 555, 308, 800 plus the 500 beds, so all our infrastructure interventions are going to create an additional 2,163 beds in Gauteng province, which we will use to deal with COVID-19 And we are saying in advance and beyond. So we are bringing forward many of our plans, which were our infrastructure plans to increase capacity in our existing facilities where we had huge pressure. These hospitals I have talked about, Kopanong in the Val, Jubilee in the north, including Krisani, Baragwana. As you know, we have high density, Soweto is high density. We have huge pressures there. So those additional new structures are being put to help us serve the people of Gauteng better. We're also preparing for the NHI so that we have additional capacity there. So with regard to the number of beds that we are giving you, we're also working with private sector healthcare providers. We are finalizing that work. Dr. Masuku and his team have been meeting with them. There will be additional beds that are going to be coming from our private sector partners, current healthcare providers. Particularly in there, we're looking at ICU beds that are going to be added to what we are doing now. And that work will be completed very, very shortly, so that there's absolute certainty, including what the partnership will entail. We have been working hard to increase the stock of PPE, personal protective equipment for our frontline public health workers, but also for other government officers and officials, including the security agencies members who are playing a very key role in enforcing all the measures and the regulations that have been put forward. We currently have 6 weeks stock. That's 6 weeks worth of supply based on the current usage, and we know that the current usage is still much lower. Should we go to the peak, the demand will be much higher. We are meeting with the unions regularly. Dr. Masuku and MEC Mamabulo have been meeting with the unions, and we are working with the unions in monitoring the stock, because the unions have been very forthright in raising the issues around PPE. So we are monitoring the stock and will continue to receive donations. We received 30,000 units of PPE from the Bank of China this week. We will continue to procure more ourselves as the provincial government, but we indeed are willing to receive any donations in kind with regard to PPE. Those who are able to buy and provide us with stock. It's something that is very, very valuable to protect our workers. So that's the first part of our response plan. This is the health response. The second response is the food security response. The Gauteng provincial government, just to share with you, ordinarily, on an annual basis, our provincial government feeds more than 200 households, 200,000, more than 200,000 households per annum. And these are households which are poor and food insecure, identified by our social workers, verified, they meet all the requirements, including municipal requirements, that they are on the indigency lists of municipalities. These are families that are confirmed also by municipalities that they are not, they need assistance in line with government policy with regard to a whole range of issues, including basic services, waivers in those type of areas. I'll come back to the criteria, the full criteria later. So when there is no COVID-19, on an annual basis, we support more than 200,000 households. But since the lockdown, we have been focusing also on ensuring that we provide this support, and I just want to share with you information that we have worked with various social partners in Gauteng province to provide food relief as of yesterday to 19,000 households, and the total 19,000 households, on average a household has got five people. This gives us 98,000 people that we have been able to reach. And what we do on a day-to-day basis, we provide up to 2,000 households on a daily basis with food supply for a month. MEC Lesufi, as he moves up and down, ensures that we're able to reach on a day-to-day basis 2,000 households. Those we give today are not those we gave yesterday, because those we give today, we give them enough supply for the full month. And I must say that we are very grateful for the support we have received from the social partners in this particular end, businesses and NPOs and NGOs that are very active on dealing with food security. So we have 5 distribution points in Gauteng, 5 food banks, which we visited on Tuesday. MEC Lesufi and myself visited all the 5 food banks. The food banks are distribution points for food. Food gets delivered in the food banks. They store the food there, but that's where the food gets distributed. So the 200,000 families I was referring to that we support in a normal year, other than now dealing with COVID, the food is distributed by the food banks. The food banks are the mechanism through which we have been distributing food to the households that need food relief in Gauteng. So those food banks have got proper systems in place. Firstly, we're very interested in the people who are on the list of each region must be verified and confirmed by our social workers that they do indeed need food relief and they need that type of support. So in addition to, so the 19,000 households I'm referring to, who in total represent 98,000 people, exclude the 3,000 homeless people. So as you know, in addition to the 2,000 households we are reaching on a day-to-day basis, but on a day-to-day basis we also provide food to more than 3,000 homeless people. The number of homeless people was high at the beginning. In many of our shelters, the reports we are receiving is that a lot of homeless people have left the shelters to go back to where they were. So currently we're talking of 3,000 and a couple of people who on a day-to-day basis are receiving food relief from the provincial government, working in partnership with these NPOs and the businesses that are providing support. We must say that the demand is huge, and this I must say that in the last week in particular, so we say to you we provide 2,000 households with food relief on a day-to-day basis, but the demand far outstrips the supply. And it is for that reason that you're seeing in different places, there are more people who are saying, in fact, we think we should be, ideally, if we were to double the number to 4,000 households per day, we would make a dent. As I say, we have more people. Some of them are workers who have had precarious jobs, who out of the current situation no longer have a source of income. For this reason, we have, as the provincial government and municipalities, we have also been looking at additional supply I want to call on more businesses to help us as we deal with COVID-19 as a health emergency. We must also take care of those who have inadequate food supply or literally have nothing to eat. And it's something that we really appreciate. More people in our country and in our province understand this. I also want to say the provincial government and municipalities are also reprioritizing their budgets. We are also talking to our national ministers to say that I know it's a matter that all the provinces are also dealing with when we have interactions through engagements with the president and the ministers. So we are looking into our own budgets to reprioritize away from, there are areas where we know money is spent at all because of the current conditions, but we want to follow proper procedures in doing that to increase our capacity to reach more people. Saying this, it must be explained again and again. Who are the primary people we are focusing on at the moment? Firstly, all the people I was talking about, that every year we have been looking after, the 200,000 families that we have been looking after every year, they can't fall off now under the current conditions. We know they depend quite a lot on the food relief that's being provided. These are verified and confirmed people who are in need, verified and confirmed by our social workers who visit them quite regularly. So that's the first category we want to continue to be able to provide food relief to. The second category are the homeless people that we were referring to. Currently, I said we're taking care of just over 3,000 of them. But there are also people who are sick. We're getting feedback from our health professionals, our public health system. As you know, you can't take medication without food. So those are also a priority area of focus for us. People who are on our various treatment regimes, who are undergoing various kinds of treatment. They are also people we know they are in the database of our public health system. We are directing food relief to them. There are also child-headed households where we know there's no one who earns income in there. Some of them may be getting child support grants, but the money may not be enough. So we are focusing on them. And lastly, there are several shelters of GBV victims, so victims of gender-based violence who are in our shelters. We're also providing food relief to those shelters because on their own, they will not be able to cope. I need to emphasize that we have put in place very stringent measures. That is why MEC Lesufi and myself were visiting the food banks, which are the distribution points. We have put in place the stringent measures to make sure that all those who deserve, who are needy, get the food relief. And secondly, we have put in place these measures to ensure that there's no political patronage networks involved in food distribution, including a situation of political interference. Now, we deal with lots of complaints that MEC Lesufi can deal with here. We deal with lots of complaints, people who say, no, I've been waiting for food, or we have been calling the call center, or we have sent emails. We deal with a lot of that. Not everybody who send their details there gets help, and MEC Lesufi will explain how many people get sifted out of that, and the criteria kicks them out. And there are also people, the way we distribute food is, if you see people in queues in the townships saying they are queuing for food, you should know that that's not government. We don't distribute food through queues. But there are many players, as I said. There are many NGOs, there are business people who go into our townships saying they are coming to help. They bring food. They distribute food, but ours is done differently. Food is delivered to each household that we know is in our database that has been verified and confirmed. And the food is not delivered by councillors or by members of parliament or members of political parties. It's delivered by our officials who work with the food banks. These are the officials of the Department of Social Development. So I want to emphasize that when you see queues of people in the community saying someone is distributing food, you should know that that's not the government. And sometimes people send messages in our communities to say food is going to be distributed here. It's good Samaritans, we appreciate that. But often those distribution mechanisms cause problems like we saw in Alexandra. Rioting, because it may not be everybody, even them, sometimes the good Samaritans who go into the communities and distribute food would not know who is really deserving. Sometimes there's double dipping. They give food to the same people we have given food. Or they give food to those who are quick to get there, who may be having food in their own household. So we want to caution about how food is distributed. That's why we want to work with the Good Samaritans. We want to say to them, bring the food that you have to our food banks. That is the place to bring. If you are raising funding for that, that's why we are already working with some of the NGOs and businesses that are delivering the food at our warehouse, the central warehouse, which is also a food bank, is in Johannesburg, and then there are other 4 food banks. And I want to call on businesses in our various regions to really be able to go to our food bank and donate. But members of the community mustn't go to the food bank and say we are coming to get our food, because food will be brought and delivered the way we have always done. It will be delivered to the needy household by those who have been to that household. Where there are additional people who have been considered as on the basis of this criteria, food will also be delivered that way. But we don't want to promise that we will give food to everybody. That's why I spoke about the criteria, the people who are focused, yes. We can't create an impression that we're going to give food to everybody. We will have to take care of the most vulnerable in these communities. Without saying that there's no need, we want to double our capacity to reach those who may not be in our current database. And that's why we say we want to move from 2,000 a day to 4,000 a day. This we will achieve only with the generous contributions of many people. I also want to say to political parties in Gauteng province, political parties must not be distributing food. I am appealing to you. Political parties, if you are able to get more food, to raise donations on food, please take your food to the food bank, either at the center, but I want to urge more that those food banks in our regions, because there it shall be distributed not on political lines, it shall be distributed to everybody who is needy, based on the criteria of government that has been set. So even our political parties, if you can raise donations for food, take it to the food bank in your region. Don't go into the community as a political party in party regalia to start distributing food. That we discourage completely, because that's where we're going to end up having accusations, and some people get because they support a particular party, and others who are needy, who may not be supporting a particular party, may be left out. So this is an impassioned plea from myself. We have worked very well with political parties. Some of them have reported to us cases and allegations where they say food have been distributed through political connections. MEC Lesotho is dealing with that every day. If it's a government official we find involved in distributing food the way it is not supposed to be done, those officials will be suspended with immediate effect. We took this message, MEC Lesufi and I, 2 days ago to all the food banks, to say to all the food banks, food must be given to those who are needy, those who have been verified, those who have been confirmed. And there should be no political party that goes to the food bank to think that they'll get food and go and distribute it. They would not. Yes, they must come to the food bank to bring more food, to help us stock more food in the food banks. Having made this plea, we want to continue to thank those business people who are making a big difference. I say that we have food that's enough to last for 2 weeks. Beyond 2 weeks, we may run out of stock. The good thing is that yesterday we received additional very generous donations. MEC Lesufi will acknowledge those businesses that have done so. Every day, MEC Masuku and I also receive calls from South Africans who say they are able to contribute something. Not only business people, even families are saying, when we buy grocery and we think we can add 1 or 2 things, where should we take the things that we want to contribute? So our food banks are the place to take all stuffs. That's where the distribution will be done without political consideration, just based on the need. The third pillar of our strategy is about law enforcement and compliance. I am happy to report that 54 people have since been arrested in connection with the vandalization of our schools, including the burning down of schools in Gauteng. The last time we briefed you, we were saying to you that the police are doing work. There were 11 people who were arrested at that time. Early this week, the number increased to 41, but today we can say to you the number of those arrested is at 54, including 2 who were arrested last night in Gauteng. The police are following up meticulously on this matter of the burning down or the break-ins in our schools. We're getting on top of the situation. Our law enforcement agencies have so far arrested 10,126 suspects in Gauteng alone for breaking the regulations, including for criminal activity, because Ukaimulao is continuing every Thursday. So 10,126 suspects have been arrested, and out of that, 9,624 cases have been opened, and 7,481 of those cases are lining up for the court processes. Once again, as the Gauteng provincial government, we extend our appreciation to millions of the people of our province who are doing very well in observing and adhering to the regulations. The number is increasing. There are more people. Yes, from time to time, attention is drawn to areas where they are going on as if there's no lockdown, but I want to say that our overall assessment is that more people are getting the message. It is about saving their own lives and those of their loved ones. These regulations are not, this is not about a government, it is about the people. So we would like more people to observe the regulations. We express our appreciation of the work of our law enforcement agencies, the men and women who are continuing to work very hard to ensure that the regulations are observed. But we also know that there have been reports of abuse, and each of those reports, when when that is brought to our attention, we talk to those in charge. In Gauteng province, the Provincial Commissioner of Police, General Mawela, would have been here with us, but there's a meeting with the minister. The provincial commissioners are meeting with the minister. Every incident of abuse where the law enforcement agencies have, like the case of the murder case in Alexandra, where a member of the Khoza family was killed, and that matter is being dealt with by the authorities. Every time there is an incident like that, we talk to those in charge. We talk to the senior police officers. In particular, I always talk to the provincial commissioner to say, the police are doing lots of good work in many areas, but when you have an incident of abuse or murder incident by law enforcement agencies, it is not good. Many communities have been supporting the work of law enforcement. We want our law enforcement officers and the security agencies to really heed the call made by the president that they must operate in accordance with rule of law. So this message must get to them on a day-to-day basis. And we must ensure that South Africans will be able to appreciate that the law enforcement is for them. It's not about imposing the will of the state. It's about protecting our people. And we who are officials of the state must act in accordance with that as well, so that our people can gain confidence from the actions of those who are in positions of authority. The fourth area of the fourth pillar of our work on COVID relates to the economy. We have done a full assessment of the economic impact of COVID-19 on the Gauteng economy. This I said last week as well. We have completed this. We have looked at sector by sector. We have also looked at the proposals that are now going to our Executive Council next week, Wednesday. The Gauteng Provincial Executive Council will look at the Provincial Economic Response Plan to the impact of COVID, both in the immediate as well as beyond this protracted period that we don't know how long it will last. So next week, briefing, that's next Thursday, the briefing we are going to give next week will focus a lot on the economy. We also have done so in order to ensure that our plan is aligned to the national plan, which is being finalized. So by next week, so the pillar that deals with the economic mitigation measures will be looked at. We believe that we've got to do much more than we had ever thought we were going to do in fixing the ailments of our economy. We've got to do much more than we ever thought we would do. In growing Gauteng together, our plan for this decade, there are specific interventions we have identified in specific sectors of the economy. Come COVID-19, that plan is no longer enough. That economic plan of our province we had put in place before COVID-19 is no longer enough, because many of the sectors that were going to be the job drivers, that were going to be the growth drivers, that were going to be the transformation, modernization, and reindustrialization drivers, many of those sectors are now devastated. So we've got to look at that afresh. Lastly, the last pillar of our COVID response plan is about social mobilization and building social solidarity in these difficult times. We have learned as a country from the struggle against apartheid and the fight against HIV and AIDS. We have learned from those two experiences the struggle against apartheid and the fight against HIV and AIDS, that mobilization of various sectors is very, very important. The issue is how you do it under conditions of COVID. But it can't be that government alone will achieve the objectives we have set for ourselves. Firstly, to combat and mitigate and minimize the impact of COVID on the people and the economy of our country. We will not achieve that alone. So, in this regard, we welcome many initiatives here in Gauteng province by civil society groups, by businesses, by political parties, by citizens, acting in their own little ways. Many of those initiatives towards combating COVID-19, but also towards mitigating its negative impact on the people and on the economy. We want more of this initiative, social mobilization. Yes, not by people coming together in rallies, because the regulations don't allow that. But we want people to use different creative means to keep in touch. Yes, physical distancing and social distancing in the context of COVID doesn't mean being away from support to those who are needy. People must do that using different mechanisms. Social solidarity with contributing to those who need help. And how are we going to do this? So this afternoon, just after this, I am going to join a virtual or electronic launch of a community action network. This is a network of activists and organizations across Gauteng who would like to galvanize communities to play their own role in a unique and different way. And these experiences come from different parts of the world. That we can fight COVID together, even though physically we are separated, but we can work together in using different and innovative ways without having to spread or create the risk of spreading infections. We can work together in different ways, particularly using technology and other innovative ways to be part of the movement. So basically, this afternoon, what we will be launching, what's called the Community Action Network in Gauteng, is drawing on lessons from elsewhere in the world and other parts of the country to build a movement where citizens in their localities can contribute to this cause against COVID-19. Some of the things that we want citizens to look at is contributing food contributions or food relief initiatives. It's not just something that must be done by businesses. It must be done by citizen groups. We have seen some of these citizen action groups that have sprung up in many different places, but which are operating in accordance with the restrictions and the measures that have been put in place. So some of the contributions is towards food, but also urging more those who can to contribute medical equipment, including PPE, those who are manufacturing some of the medical equipment to be contributing this equipment. But also these citizen action groups, we must call on a lot more of our people to also produce for themselves these cloth face masks, like the one that I was wearing when I came in here. This is made here in Gauteng, made in the township in Sharpeville by a township manufacturer. And we heard from both the minister and Professor Karim during that public engagement that the masks can play an important role, especially those who may be infected, in preventing infections through the droplets. So we want to, through these community action groups, we want people to find different creative ways of contributing to the fight against COVID-19, including we want more health volunteers, professional more health professionals who will be volunteers. We have health professionals in our system, but at community level, we want at community level health professionals to be able to volunteer as well and make their contribution. We believe together we can win the battle against COVID-19 so that we can continue to work together to grow Gauteng as a province which we love. We wish to thank, lastly, all workers who are engaged in essential services, who continue to do a great job of ensuring that they meet the demands of our residents in various areas of work. In particular, the health professionals, the various emergency workers, the law enforcement and security officers who have been doing tremendous work, and particularly those who have been acting according to book, who have been conducting themselves in accordance with the law. We're giving a shout out to them. We're saying we appreciate the work that they have been doing. And I want to conclude by, again, just repeating the measures that we always, these measures, firstly, we're saying to the people of our province, let's all wear the masks. You see, those of us who are not health professionals will not wear the surgical masks or the N95. Let's all, the cloth face mask can play a significant role, especially when we go out in public. Social distancing or physical distancing of at least a meter away. Let's continue to ensure that we observe that. Let's wash our hands or sanitize our hands as many times as we need to do. Let's cover if we cough or sneeze, let's do that the way it has been done, through the flexed elbow or using a tissue, which will get thrown away immediately. And let's ensure that we avoid touching our eyes, our nose, our mouth with unwashed hands. And let's bring hygiene, make hygiene normal in our homes.